Hello everyone. Good evening. My name is Dr. Rupali Satija. Today we are here to discuss a very important topic which is related to the post-delivery, and I'm sure many of you have experienced all those things which I'm going to talk about, and some of the females who are in their pregnant state right now might find it helpful as well. So let me know if you have any questions during the session. I will go through all of the questions one by one. So the first thing that many people have asked me, and I want people to know, is that how do we prevent the infections after the pregnancy? So you should understand that uh, pregnancy is as important as the post-pregnancy state. So it does not mean that you've taken 9 months of care for the baby and you've done everything right, and once the baby is there, you forget yourself. It is very crucial that you take equal good care of yourself in the post-pregnant status as well. So the best things to prevent infection, uh, either vaginal delivery or C-section, what you have to do is you have to keep that area clean. So I'll go one by one. If you've had cesarean section, so you might be having a scar. There will be scar tenderness as well, which will go away in few weeks. But all you have to do is keep that area dry and clean. If you have a bandage there, change it regularly. Some doctors prefer to keep it open, so discuss with your doctor as to what has to be done. But you have to definitely keep it clean and dry. If you've had normal vaginal delivery, obviously you'll be having a scar there, because commonly we do episiotomy these days, which is that you stitch the lower part. That is safely done these days. So in that case, what you have to do is you have to keep that area again clean. There might be some pain. You can sit in warm water and then keep it dry. Change the pads regularly. This is one of the most important things to be done, that you have to change the pads regularly till the time you're having the discharge, whether C-section or vaginal delivery, anything. If in case you feel that the discharge is odorous or it has become more, talk to your doctor. They will definitely help you. So the next thing that is very common among, especially among the young females who are new mothers, is how to take care of your breast while feeding, because it's everything is just new. There's secretions coming from your body which you've never experienced. So in that case, what you're supposed to do is that, again, keep the area clean. If it is very tender, and some people secrete lot of milk, so if it's very heavy and painful, you can gently massage your breast. See, it should not get very hard. If it's excess of milk, just drain a bit, or you can just take it out and store it under the refrigerator for a while as well. Frequent breastfeeding will definitely help you. You should know that newborns feed about 8 to 12 times in a day. So you have to be ready for it. Feed from both of the sides so that one side does not get engorged. If at all you feel that there is any lump or anything, you should definitely consult your doctor. Sometimes if the baby does not latch properly, there can be soreness of nipple, there can be even cracks. So in order to prevent that, what you have to do is you have to see that the baby is latching properly to the nippler area. He or she should be taking the entire nippler area in their mouth. So this will prevent any sort of injury. If you experience any sort of redness or anything, just consult to your doctor. Now, the next thing that is asked to me is that what all things we should take care of when we are post delivery. So it's a huge topic actually. So just a gist of it is that you have to take care of both your mental and your physical status as well. Female needs lot of rest and lot of care once they've delivered a baby. It's a huge thing that they've done. Carrying a baby for 9 months is not at all an easy job. And plus, once the baby is there, all you have is sleepless nights, and nothing is scheduled because the baby does not know when to sleep, when to eat. So it's all a mess initially, but you will get the hang of it. What you have to do is take out time for yourself, take rest. Commonly said thing is when the baby is sleeping, you should also sleep. Practically, it's not possible all the time, but you should try as much as you can. The next thing is take care of your ions and your vitamins. One thing many people forget is that they take care of their vitamins and iron during the pregnancy, but they stop taking it afterwards. What happens is that because you are having a lot of bleeding, a lot of discharge post pregnancy, many females lose a lot of blood and they are at a risk of getting iron deficiency anemia. Plus, the second thing is that all the milk that baby is taking from you during the feeding, all the calcium and the essential vitamins are going to the baby because your body is made that way that you have to protect the baby first. So that is what the breast milk also does. So you are left with very less calcium and vitamins in your body. So by the time you're feeding, be sure that you are taking all the supplements properly and regularly. And if at all you experience any sort of pain or weakness, you should consult with your doctor. The other things that are commonly seen is that female gets skin infections, which many do recover once you've delivered, but if not, you can easily take help of your doctor. Plus, hair loss is quite a common thing experienced by females. You might lose lots and lots of hair in the initial 2 to 3 months of your delivery, but it's fine. It will recover back. You can use basic oils and everything that might help as well, but don't be scared because the growth will come back. So next thing that one should know is that what to do if you experience any sort of pain or fever. So if at all in the pregnancy duration you've got fever or anything, that is not a normal thing to experience. You have to consult your doctor at any point of time if you feel that you're having even the slightest of the fever. I hope all of these things might have helped you. If you have any of the questions during the session, just let me know. I'll love to answer those. Okay, so if in case we do not have any questions later on, if you have any of the queries which you want me to settle, you can send it in the inbox and I'll love to help you. I hope the session has helped everybody. Thank you. Take care of yourself.